At this time, I'm honored to welcome our keynote speaker, Dr. Colleen Kraft, current president of the American Academy of Pediatrics. She brings with her a wealth of experience of complex chronic patients through multiple programs at Cincinnati Children's, and she was also a CMO of a Medicaid managed care program in Virginia. In addition, she has experience as a pediatric residency program director, a pediatrician, and even chairs the National Advisory Committee on National Center for Health and Head Start at the American Academy of Pediatrics. So please welcome Dr. Kraft.
Good morning, and greetings from having come from Detroit, where I spent the night in the airport. I would have loved to have been here, and I'm just so happy to be here with everybody. Let's see, we're gonna go ahead and get started here. So we're gonna be talking about adventures in child health, and so far it has been quite the adventure this year in 2018. I have, let's see, no disclosures. And in terms of learning objectives, I really want to update you on the economic and political and environmental factors that are affecting child health in 2018. And in that, understand the priorities of the American Academy of Pediatrics and the agenda for children. And what I would like to have you do from here on out is commit to one advocacy activity in the next 6 months. And what you're going to find is it's not that hard, and it's not that time-consuming to be a child advocate. Because if you've read the news or listened to anything in the last 36 hours, you know that our voice needs to be heard for kids. So setting the stage, we're at the 116th Congress, and we come to this Congress with our own priorities for children. This is the AAP blueprint. If you look this up and just look at the AAP blueprint for children, Google that, you'll find this document. And this document was actually put together in 2016 when both candidates were running for president, and it was brought to both of the candidates to show them what we need the government to be doing, whether it is health insurance, whether it's USDA and what they need to be eating, whether it's SAMHSA and what we need to be doing in terms of substance abuse prevention. It's all in there. And if you talk to Mark Del Monte, who is our Chief Advocacy Officer, he'll tell you the blueprint is Plan A and we do not have a Plan B. And I think what the lesson that I've learned so far in the first month of being president of the AAP is that we have to be speaking for children, and that children are both bipartisan and nonpartisan. They are Republican, Democrat, Independent, and we have to speak to their needs. And the Blueprint for Children does that. It looks at what is evidence-based and best for children, and it really is the way that you can come through when we look at policy. So as we look at our agenda for children, we're looking at a couple of things, including addressing bias and discrimination in physician health and wellness. But let's talk a little bit about some of the things that have happened in the last couple of weeks. And you'll find me zipping through these slides because these slides are old. When you look at what's happened in the last couple of weeks, a lot of things have happened in through there. So the Children's Health Insurance Program has now been reauthorized and funded for 10 years. That's a big, big win, and it's because of you and your advocacy for our kids that this has happened. But it's also happened because of some politics. So let me explain a little bit behind the Children's Health Insurance Program. This program expired, the funding expired at the end of September of 2017. And many of you wrote to your senators and wrote to your congressmen and went on the media and went on social media and talked about how kids need health insurance. And let's not stop care for children when they're in the middle of cancer chemotherapy, or if they need their shots and immunizations, or if they're a baby in the NICU. They need to have that coverage, and that CHIP is a great bang for the buck. Well, what happened was we were heard, but then the tax bill happened. And what happened in the tax bill was this: the individual mandate for the Affordable Care Act went away. So we no longer had the individual mandate. The Congressional Budget Office looked at what was it going to cost to insure kids in that CHIP group. Because if they were insured in the exchanges, it turned out that was a lot more expensive than insuring them through CHIP. And so what they came up with in their formula was that CHIP for 6 years would actually be budget neutral. And that's why in the tax bill, CHIP was authorized for 6 years. What they also came up with is if we authorize CHIP for 10 years, we'd actually save $6 billion. So why wasn't that in the tax bill? Well, we need that $6 billion to horse trade somewhere down the line. And that's exactly what happened in these continuing resolutions. So in the last continuing resolution, the $6 billion offset from insuring kids longer in CHIP came apart and came about because that money was used for other things. So it's really interesting when you look at how this happened. But what happened was that we now have health insurance for these kids of working parents, of people making less than 200% of the federal poverty level in place for the next 10 years. And a lot of that is because of who you are and what you have done here. So we continue to have some gridlock in other areas, but this last continuing budget resolution did a lot for us in terms of some of the other priorities we have for children. So what else got funded? What were our other wins in this? First of all, the McV program, the Maternal Infant Early Childhood Home Visiting Program. This funds home visitors to actually go and help out our families who are really struggling with parenting issues and really struggling with poverty. This has been a great program, and it's a program that we have supported, and that funding came through for 5 years. Community health centers were funded. The special diabetes program was funded for 2 years. There were 2 really big pieces of legislation that were wins for us with our kids. One of them was the the Families First Prevention Act, which is actually putting some funding and resources into the budget for families who might be losing their homes or losing their kids to foster care. So it's really going to help out our poor families with some of the supports they need, so they may not have to put their kids in foster care while they're going through therapy for opioid treatment, or if something is happening in terms of a crisis in their family. The other thing that got put through was legislation to make sure that we've got the resources we need for physical health, for mental health, for housing, for food, in the case of disasters, since we had so much that went on with disasters this year. So some of the other things that are happening that are really important to talk about, and things that I'm being asked about. First of all, with what's happened in the last couple of days with school shootings and guns. So let me tell you a little bit about where the Academy stands on this. And I will tell you this as somebody who is a gun owner and has a concealed carry license. And that's real different than most AAP presidents. But, you know, I like going to a target range and shooting. And I understand the gun culture. I grew up hunting woodchucks, and, you know, guns were part of my growing up. But, you know, I think that even people who are with me in this know that the unfettered access to guns for anybody without any kind of public health restriction is bad for children. And the attention comes out when we have these mass shootings, but that's not really where the problem is. It's part of where the problem is. The problem are the kids that you see. They're the kids who shoot a sibling and it's an accident, an unintentional injury because the gun wasn't locked and put away right. It's the kids that you're seeing committing suicide because they've got a gun in the home. It's some of the homicides that are happening because people act before they think. And what we need is a real public health approach. We need a bipartisan group of people who understand the gun culture and growing up with that responsibility and that right, and be able to say, what are the public health programs that we need to put in place to keep our children safe? And I think we can take a lesson from the automobile industry, because when we looked at automobiles, we didn't say you couldn't have an automobile. We said, well, gee, what's the training that somebody should have to drive an automobile? And how old should they be? And what happens if they abuse that privilege? And I think we just need to be looking at common sense approaches to doing this with guns as well, too. And we look to Congress to do this. And as the Academy, we're going to be talking about a public health and public safety approach for our kids, because the mass shootings bring up all the news, but it's the day-to-day problems we see with unintentional injury and suicide and homicide with our kids that we need to keep up and talk about. Finally, one of the questions I get asked about a lot too is about marijuana, because a lot of states are starting to look at marijuana and making that legal in their states. And where the Academy has come out is in a 2015 policy statement where they supported decriminalization, but not really legalization. And why? Reasons that you know that are common sense, once again. First of all, developing brains are great avenues to become addicted. And our teenagers are going to be most likely to become addicted to cigarette smoke, to nicotine, to marijuana, and they just need to not be exposed to it. But secondly, there's a whole rise of these edibles. So you can get marijuana gummy bears and marijuana brownies, and our kids are being poisoned by them. So we really are looking at, really think twice about legalization, and that we have to think about these marijuana products just like we think about our guns. We got to keep them locked in a safe away from our kids. So finally, we've come on to DACA and immigration, and where the Academy falls on this is that, first of all, our dreamers are kids who are contributing to the economy, and we need to keep them here and keep them safe from deportation. But secondly, let's have a common sense approach to this too. Families, kids, we can't be going into hospitals and finding our kids who are undocumented and sending them elsewhere. That's a real violation of human rights. Let's keep our borders safe, but let's watch out for our kids and families and not separate them. So that's where we are on these sorts of things. How have we been really working with our advocacy? We've been engaging our chapters, and the Kentucky chapter has been a great chapter to engage, because if you look at the Kentucky AAP website, you're doing and looking at a lot of the same sort of things. Recently, the Kentucky chapter just got one of our grants looking at protecting kids from e-cigarettes. Really important, because e-cigarettes are now the new way that kids are starting in cigarettes. And what's happening is this: they're being attracted by the flavors in e-cigarettes. So, the point that I've always made to the FDA is that maybe e-cigarettes are good for adults to stop smoking. But really, what kind of Marlboro man is going to give up his cigarettes for gummy bear flavored e-cigarettes? Really? They are marketing to children. And again, when you think about the way that cigarettes get nicotine into your system versus how e-cigarettes do it, you've seen people take that first puff of their cigarette in the morning, and they take a big puff and then they relax. And they do that because their nicotine level goes way up, and then it goes down, and they've got that nicotine in their system. Doesn't happen with e-cigarettes. E-cigarettes, you get little bits at a time. And so you have little bits in your system, and if you're an adolescent and you're getting that little hit of nicotine, you've got that developing brain that is primed to be addicted, and you're gonna want more. So what are you gonna do? You're gonna become a smoker. So e-cigarettes are a pathway to smoking for teens, where they may be a pathway to quit for adults. And making that case is really important, and making the case that if you get rid of the flavors, then you're not going to attract the kids is really important. And so that's where the Academy is coming on too. So how do you find your own voice? Where do you start with grassroots advocacy? There's a great site called federaladvocacy.aap.org that's on here. And if there's one thing I would have you take from this talk, is go to that site at some point in time, because you can do some very practical things there. You can register as a key contact. And if you do that, you will get just a weekly email with what's happening in Congress, what's happening in some of the states in terms of our advocacy points. You can also put this onto, you can also send a letter to your senators, congressmen, governors, and your own elected officials through there, because we have CapWiz and some of the ways that you're able to get your message to Congress. So if you do nothing else, this is the one thing I would have you do, because this could give you your 5 minutes of advocacy a week where you might make a difference in the life of a child, and you might make a difference in the practice of your patients and your own practice. Within physician wellness, one of the things that I've looked at trying to do is advancing child health through the practice of pediatrics, and looking at value-based payment structures, team-based care, non-traditional medical home partners, and technology. So some of the lessons from value-based care is that we can have risk stratifications with targeted population level interventions. That when you look at this, we need to know who our patients are, and that's attribution. That we can measure interventions and outcomes, but at the core is that we need to keep that trusted relationship that you have with your patients together. So I'm going to click through some of these. Okay, and talk a little bit about team-based care, because team-based care is really where this is at. When you look at the Academy and asking us to now screen for poverty and look at mental health and be able to look at other things that we've not been trained to do with our kids, the team is super important. And because you can actually work with your nurse and she can become a care manager for some of your more medically complex kids. Some places and some pediatricians are taking their MAs and training them as scribes. So they room a patient and then they sit down and they start doing the scribing. That way you're not stuck doing 2 hours more of electronic medical records at night after you're done seeing patients. Some people are taking those home visitors that we now have funding for and co-locating somebody in their office. And they're doing that so this person can actually work with some parenting skills with your patients while they're waiting for their immunizations, while they're waiting for you to come in and see them, and then maybe make a visit to their home and see what that environment is like. There are people who are now having co-located behavioral health therapists in their office. And this is something that I've worked on in other places in the country and is actually something that Medicaid managed care is looking at and funding. So let me tell you a little bit about some of the places I've been to. I was in Buffalo, New York not too long ago, where that group was able to work with Medicaid managed care and get them to pay the salary of a behavioral health worker, of a therapist, to come and be in their office. And so there are 8 offices and there are 3 behavioral health workers who spend their time 2 or 3 days a week in each office co-locating so their kids with Medicaid have access. Because they made the point that if you give a family a phone number, you've created a barrier, and particularly if it's a family that doesn't have transportation, they're not going to get those behavioral health services. And what made even more of a point is that Medicaid managed care has HEDIS and other outcomes that they need to try to reach. And one of the big issues that they had was having kids on antipsychotics before they were getting behavioral health therapy. Well, hello, if there's no access to behavioral health therapy, what are we going to do as physicians? A lot of people are writing for medications. And so they look to say, okay, let's do our part. Let's fund a behavioral health therapist so these kids can get that therapy and maybe they'll be on more appropriate medications. So then I went to Houston, Texas, where I went to a practice that was looking at starting an asthma care management in their practice, and Texas Children's Health Plan was there. And we talked about having a behavioral health facilitator in their practice and co-locating. And guess what? Now Texas Children's Health Plan is going to be paying for a behavioral health therapist in that practice. So a couple of weeks ago, I was in South Carolina at their quality improvement meeting and talked with one of their Medicaid managed care directors about doing that in South Carolina. And he's in talk now with the folks in Buffalo about how they did it, how they're paying for it, some of the logistics. So this may happen. So any of you that know somebody in Medicaid managed care and thinks it would be a great idea to have them pay for a behavioral health therapist to co-locate in some pediatric offices, touch base with me. We've got some other people who are doing this, and I'm hoping to be able to spread that throughout the country. Behavioral health and primary care is certainly important, and the idea of integrating it has come by and is on its way. And like I've said, other places are beginning to do this now. Project ECHO is something that the Academy has started doing that will help our pediatricians, particularly in rural areas, care for some of their more complex kids. What Project ECHO is it's a program where you can dial into some continuing education, but then you can take this and look at what's happening in your area, and you could have an expert in developmental disorders and autism help to coach you and help you out with some of your kids who are more difficult to manage, or some of your kids with seizures, or behavioral health, or Zika, or some of these things that we really were not trained to manage. Telehealth is a big area that the Academy is working on as well too, because it can be the great connector. It could really do a lot to improve access to care. But we've seen it really used in a bad way as well too. So any of you who've ever had a patient who's used teledocs and they've dialed them up at 3 o'clock in the morning because their child has had a fever and they've wound up with an amoxicillin whether they needed it or not, has shown the really bad part of telehealth. And we get this at the Academy. So we're really looking at how do we look through the whole guidelines and the whole roadmap of the right way to use telehealth. How do we connect it with the medical home and not make it fragmented with the medical home? How do we use it to enhance services? How do we get it paid for? There's a big difference. I've worked in Virginia and in Ohio. Virginia, it's paid for. In Ohio, it's not necessarily paid for. It's only paid for if you go from one institution to another. I know Kentucky's a pretty good state in terms of paying for telehealth, and so looking at that, we're looking at Kentucky as a model. At the PEDS 21 conference, which is the day before the national conference and exhibition, is going to be all about telehealth and how people are using that, whether it's at a subspecialty level to bring subspecialty access to some of their patients who are far away, whether it's at a primary care level. Some people are beginning to use this as nurse triage, so they could look at a diaper rash so a child isn't going to the emergency room because of it, or they can talk to a family with a child that might have a fever but may be well and not even need to come in, and be able to use this as a method to just improve and extend care. So finally, I'm going to say a word about our new home in Itasca, Illinois. So the Academy has moved from Elk Grove Village to Itasca, and one of the reasons that they built this new building was to really meet the needs of our pediatricians in 2018 and beyond. Because we know this, different than past years, our pediatricians are a lot younger, they are primarily female, they are not going to take a weekend and come to a meeting, but they want to be involved and they want to have their voices heard. So there's a lot of great video conferencing technology here. I've been to a couple of meetings virtually at the Academy where you see the whole group there, and you might as well actually be there in a meeting. But it's something that you can do for a couple of hours. So if you've got to see patients in the afternoon, or if it's a weekend and you've got a child's soccer game or something else that you need to do, you can do that without having to fly all over the place, take that time out. Really integrate the Academy and your leadership and your voice with your life. And that was the whole point behind this. The Digital Transformation Initiative was also put into place to help with what we've seen as a real problem with the Academy, particularly with their website. And I can announce to you that their website doesn't suck anymore. It has not ever been a great website, and it really is much better now. And you should try going on it. I've tried going on it, and I look at it from week to week. And because it used to be that you would put something in their search engine and you wouldn't find anything. Now their search engine's pretty good. And when you go onto the first page, you find out what's the policy that's going on there, what's really in the news right now. If you need to find a policy, you can do that easily. Healthychildren.org, which is our site where the information is for parents, you can find those topics very easily and print them out if you're in your office. So it's a much better way to do that. The next step, now that they're getting the website in order, is to make this mobile, because we know that our pediatricians, many of our pediatricians, not only our younger pediatricians, but some of our older ones too, like doing things from their device. So what can we do to make it from your device, to get your device to be able to find what you need on the AAP site? Some of the Friends of Children proposals and things that we have decided to fund as well too. The Community Access to Child Health projects, which are the little $10,000 mini grants that you can get if you want to start a community program, is there and being funded. The Healthy People 2020 grant program, where Kentucky was able to get one on educating the public about e-cigarettes, that's continuing to be funded. The 2018 AAP Leadership Advocacy, we are going to have a fly-in of our chapter presidents and vice presidents, and kind of a mini legislative conference to work on them with advocacy have them meet their elected officials in Congress, and that's going to happen at our legislative conference. And then medical Spanish certification. We've actually paid for a program that would help you if you speak some Spanish to actually become certified. And the first cohort is starting with that. We started with 1,000 pediatricians, and the program filled up pretty quickly. If it's something that's successful, we may offer it for more pediatricians. For the Tomorrow's Children Endowment, our Child Health Data Registry. Another really important initiative because we are looking at beyond what do we do in terms of our child health data. And what we'd like to start doing is collecting this from electronic medical records, from schools, from WIC, from public health agencies, from insurance plans, and be able to track our children to see if they're getting what they need early on, what does that do to them in later life? And in doing this, we'll be able to get Medicaid data as well too. And so, it would be the first time we would actually have a database that goes across from one state to another. We can begin to compare rates of being paid and who has access and what does their health look like later on. So I'm just going to end this up and say what we're doing to improve child health in 2018 from the American Academy of Pediatrics are all things that we need to be looking at for our children and for our pediatricians, because your voice is important, your practice is important. What we can do to help offer some of the innovations that are going at one place in the country and bring them to Kentucky is important. And we are all dedicated to the health of our children and the success of our pediatricians to be able to be on the ground for those families. Because day to day, it's that trusted relationship that moves that parent towards doing the right thing for their child, that inspires that child to do the right thing for themselves. And I just want to say thank you and congratulations for all you're doing. Thanks.
What is the official stand of the Academy on children playing football? Apparently, there's enough research to show that they should not be playing football while the brain is still maturing.
So the question was about the official stance of the Academy on kids playing football. And where that has not specifically come out, there is a more general statement about children and risk of head injury, and that children with developing brains have a greater risk of head injury, and any sport that increases that likelihood is something that we wouldn't recommend for kids. And I think that we're finding that parents are beginning to pick up on that as well too. So they're looking at when those kids go into football, making sure they're not doing it quite as young, but the Academy is really very much behind that because we're seeing the effects of traumatic brain injury.
Any other questions? So Dr. Kraft, we appreciate your perseverance in getting here today.
Thank you. I love Kentucky, and thank you so much for the invitation. Thanks.